Definition: to inspect if there are any presence of the chest problem, to examine the chest and lungs in order to determine the line nature of the so that the diagnosis can be made. So the purpose is to determine if the patient respiratory system works very well, and to determine if the patient experience difficulties breathing, to determine abnormalities and have an early diagnosis. So the equipment are stethoscope only. So the consideration before, during, and after the procedure is to explain the procedure and provide privacy and observe any abnormalities and perform hand hygiene. So things to document after the procedure and document any findings and abnormalities.
Inspect the client wall for asymmetry, abnormal respiratory rate and pattern, accessory muscle cues, masses of scars of paradoxal movement. This to identify the early signs of respiratory problems and promote nursing interventions. Inspect for related structures like spinal cord, skin, tongue, mouth, fingers, and nail bed. This to assess of respiratory structure problems and hypoxic signs of symptoms. Place the palms of both your hands on the interior and posterior chest with the thumbs about 2 inches apart. The fingers spread apart rounded through the entire thorax. This to feel the observe of abnormal chest expansion, scars, lump, and ulcerations and tenderness and percuss the thorax over intercostal spaces, not over bones, by following this sequence. This to ensure the proper assessment of percussion sounds such as flat, dull, resonant, and hypersonant or tympanic. Percuss the diaphragmatic excursions. Ask the client to take a deep breath and hold it while percuss downward along the specular line until the dullness is produced at the level of the diaphragm. Mark this point and repeat on other side. This to determine the distance of diaphragm of the able to read the access of the certain respiratory disorder. Ask the client to take slow deep breath through the mouth. Listen to each side through the full respiratory cycle. Then auscultate the chest using the same pattern as the percussion with the diaphragm of the stethoscope. This to note breathing under the pitch of the breath sound. Identify the sounds heard upon the auscultation of both lungs filled. This to assess the differential normal from adventure lung sound.